Hi, I'm Dr. Amol Gupta, and I'd like to welcome you to our podcast, COVID Experts, interviews with top physicians and scientists. Through this podcast, we will share the latest clinical and research advancements across the globe to help you better understand the situation with coronavirus and what our future holds. If you have any questions or concerns, please do not hesitate to email us at info@covidexperts.org. Welcome to COVID Experts. Today we have Dr. Chow with us. He is the Vice Director of the National Clinal Research Center for Respiratory Diseases in the People's Republic of China and has published a number of articles. He's been on the front lines in Wuhan. Today we're going to get an opportunity to talk to him and hear about his experience. Dr. Chow, thank you for being on with us today.
Okay, thank you for a kind invitation.
Let's talk a little bit about how you first got involved in the COVID epidemic. Can you walk us through that journey?
I was called at the end of December 2019 as a consultant. At that time, yes, we have no idea about the causative pathogen because my colleagues and I have been working with influenza and pneumonia as our major for more than 20 years.
What was the first breakthrough that you would say in really identifying that this is the COVID-19 virus? What was that point?
The breakthrough is from a virologist of the Chinese scientists. They find that it's coronavirus, but the genetic analysis coronavirus has a similarity with SARS coronavirus is about 80%. So it's clear that it's a new coronavirus. This novel coronavirus can cause pneumonia, and some of the patients may develop severe pneumonia and sepsis.
Now, you are in Beijing, so you came to Wuhan. Can you describe for us what your first month was like in Wuhan?
During the first 10 days, yes, I worked with the local clinicians and scientists there, and we drafted the first version of the diagnosis and treatment guidance. During my first visit, yes, we also worked together to draft a flow from the early diagnosis to the admission to hospital or ICU admission and the mechanical ventilation and or even ECMO. It is a teamwork, not only the doctors and nurses. And I'm happy the COVID-19 pandemic under control, not only in Wuhan, but also in mainland China. I think it is an achievement of the whole team.
I completely agree with you. And we're seeing now as the pandemic has spread around the world that this teamwork is becoming more and more important. I was reading about you and I saw that you had done a lot of research in the past when it came to influenza, SARS, MERS. Can you explain the similarities and differences between this virus and those viruses?
I think it's a good question. Yes, as I mentioned, that my team and I have been working for viral pneumonia for more than 10 years. I established my research interest. It's because of I have the first experience with SARS. In 2003, I have great interest in the clinical research of pneumonia. The COVID-19 is very similar to SARS. And for clinical research, we follow the research design as we have done for influenza viral pneumonia, including how to calculate the sample size and how to design the clinical outcome.
You're currently working on some research papers. I know that you recently published in The Lancet. What were the findings of that paper?
The first paper is published in January 24th. I remember the date because it is our Spring Festival. We describe the clinical features of the first 41 cases. I believe that after the publication, I received emails all over the world. Yes, they told me that they got to know the disease from our publication. In this paper, yes, we give the disease a portrait. It is very, very early report, and it helps clinicians all over the world to get to know the disease even before. The second paper published in March, we have to answer another question. That is that how the disease progress from the very early beginning to the late stage. In our second Lancet paper, we show the dynamic changes of symptoms such as the cough, such as sputum, such as short in the dress or dyspnea. And we also show that usually the patients develops severe illness on the days around day 9 or day 10. It is clear that from our report, patients may present very mild illness, such as fever, such as the dry cough. And we have 3 independent risk factors that are, first, the elderly age. The second is the SOFA score. So it seems that for severe COVID-19, the clinical symptoms sepsis. When we talk about sepsis, it's clear evidence that the sepsis is caused by virus, not by bacteria. Now we have more evidence that sepsis can be due to solely viral infection. In this paper, we detailedly show our findings about the SARS coronavirus 2 viral sepsis. So after you read the paper, you will better understanding what I mean about the viral sepsis. The third risk is a higher D-dimer. It is the first time that we find patients in pneumonia. The D-dimer is a predictor for death. It is because of the SARS coronavirus 2 bind to endocytes by the ACE2 receptor. As soon as the sepsis develop, as soon as the viremia develop, the virus can bind to endocytes of the small blood vessels and cause damage to endocytes. As soon as there's damage of endocytes, there will be a class formation.
And I think that those have really shaped a lot of the ways that people around the world are stratifying the risk for patients has been based on the findings in your paper. Now, I know that one of the burning questions today is, is there a treatment or a potential treatment for this condition? Has there been any work in that space that you have been a part of?
As soon as we got positive pathogens, the coronavirus, immediately think about SARS treatment. There are 2 drugs come out. First is the Lopinavir, and the second is Remdesivir. During both SARS and the MERS, Lopinavir is used for treatment, and there's some clinical evidence. So this is why we designed the clinical trial to investigate the efficacy and safety of Lopinavir. And the good news is that we have published the data of Lopinavir trial we call Lotus China trial in New England Journal of Medicine last month. During the last 2 months, my team and I have already tested 2 treatment options. The first is Lopinavir, and second is Remdesivir. So this is what we have done for the treatment options for COVID-19.
Since you have been on the front lines and been one of the first people involved in handling this COVID-19 pandemic, both as a scientist but also a clinician, what is your guidance to healthcare workers on how they can protect themselves during this crisis?
Advice is that the doctors and nurses are human, and we will be very tired after long-term care. Our doctors and the nurses to help each other. Yeah, so advice is that you should not stay in the ICU isolation ward for so long time. Take good rest. Take care of yourself. You can take care of your patients.
This virus, as per our discussions and all the research that is coming out, is said to be, it may go into remission, but high chance that it may relapse. Looking at this course, what are the burning questions today that the scientific community needs to answer so that we can not live in fear of this virus coming back tomorrow, even if it goes away today?
You have 2 words. The first is relapse, and the second is reback. But we have to be very cautious about this wording. From the animal model research of the Chinese scientists, it seems that it's not easy for the animal to have the second round infection. many scientists are doing the zero surveillance of the general population. After the patient recover from illness, it is not easy for them to get infection again. So it is not can cause relapse. The problem is that there's many general populations have no contact with virus. So I believe that vaccine will help the human beings to overcome the problem.
How long do you think it will be till a vaccine comes out for COVID-19?
Yeah, good question. Yes, I know that both Chinese and American scientists are working day and night, yes, to develop the the vaccine. I believe that it takes time, maybe several months. Not only the efficacy of the vaccine, but also the safety is an issue. The clinicians and scientists should answer another question. Yeah, what is the long-term accuracy and the long-term safety of the vaccine for this novel coronavirus? So there's no a definite answer to your question now.
Some people are raising the questions of antibody-dependent enhancement that can happen post-vaccination and actually make the vaccination against a COVID-19 strain make the other 4 strains of the normal coronavirus that we are all exposed to on a daily basis. If we were infected by those, then we would actually it could be that we have a much worse response. Is there any literature to support a philosophy like that or a thought like that?
I'm confident that vaccine will be successful. ADE is always a concern, but not every vaccinated individual can develop ADE. There are some progress of the scientists to understand the subgroup of the population are likely to develop ADE, but not everyone. And I think ADE can only affect only a minority of the population. Most of the people will be very safe if he or she receive vaccination.
So last question, share your general perspective on the course of COVID-19 in the coming months, on how you think that this is going to evolve, what the natural course might be.
I cannot predict the how many months or how many years COVID-19 will persist in general population. First, I have mentioned the success of vaccination, and second is that the virologists and the clinicians should closely monitor the change of the virus. But we have to be very, very careful about the change of the virus. All these questions, yes, we have no definite answer. Maybe after several months, we will be more clear about the problem.
Thank you so much, Dr. Chow. This was very informative, insightful, and inspiring.
Thank you for listening to COVID Experts. Tune in for more conversations with some great minds on the subject. I'm Dr. Amol Gupta. See you next time.